So if you have a parity problem, it is important for you to speak up. You or your employer pays insurance premiums for healthcare coverage, and you have a right to get mental health and substance use disorder treatment as required by law. When you file an appeal or a complaint, you put the insurance plan on notice of a possible violation, and it may prompt them to look at their internal operations. The ins and outs of this law are really complicated and has taken years for health plans to understand what is required of them. And this is just in Tennessee, this is a national thing. It's been very challenging for health plans. And when you file a complaint or an appeal, you actually make these laws stronger. Complaints and appeals to state and federal agencies are important because the government bases enforcement of parity laws on the number and types of complaints and appeals received. So the first year that the department submitted its report to the legislature, I think they had like 12 complaints. And we all know, just hearing from Deborah and Kelly, that just what they said, there might be some parity violations out there. But if you don't go to the department, they don't know. They don't know that there are problems out there. So by filing a complaint or an appeal with the government, you are helping yourself and everyone else who isn't getting the care that they are entitled to under the parity laws. And here's why this is so critical, is because we're living in a time when 1 of 5 individuals experience mental illness each year. And it takes on average 11 years for somebody to get care from the time that they first have symptoms. Fatal drug overdoses in our country are at an all-time high here in Tennessee and nationwide. And in 2021, 94% of people over the age of 12 with a substance use disorder did not receive any treatment. And those are some SAMHSA figures. That's scary. So this is why it's important for you to speak up if you perceive a violation, so you can work this out so other people can benefit and you can benefit as well. I briefly want to mention the difference between a complaint and an appeal. So an appeal is when you want the insurance plan to have a different decision. You want a different outcome than the decision that they've made. And that complaint can come, or that appeal can come from you or your provider. So the appeal is the formal written request for a different decision. A complaint is when a consumer feels they have been wrongfully denied a claim by their insurance company. So this is also important. Members and providers may be hesitant to file a complaint or an appeal for fear that the health plan may drop them or even get even with them in some other way. So rest assured that this is strictly against the law to retaliate, and health plans know it. Also, state insurance departments, and they're the ones who receive most of the calls about the complaints. They say that complaints and appeals are filed all the time as a standard part of the insurance business. And in many cases, the health plan ends up reversing their decision. So this past year in the legislative session, the Department of Commerce and Insurance submitted their annual report to the legislature. And they were able to work through a lot of the issues. And I think they had 5 complaints. And in each of those complaints, the department was able to resolve those in favor of the patient. So this is why it's so important to go to the department. And that's what we're going to do next, is show you how to make these appeals. So we're going to walk through the steps, the best sequence of steps to take action when you've been denied care. So the first step, you want to try to work with your health plan. The member and provider should discuss the recommended treatment and the goals that you're trying to achieve and write them down. Be specific about your treatment goals. You should explain how the denial of care affects the member. You might want to consider how this affects your ability to work or keep a job, your ability to complete your education or care for yourself or your family. If the health plan has proposed an alternative course of treatment or maybe an alternative medication, discuss how it falls short and why the original prescribed treatment is still preferred. If you don't get the solution that you want, the next step is to complain to the health plan's consumer services department. The phone number is often printed on the back of your insurance ID card. Often the health plan will change its decision if the reasons for the change are explained in detail. They just need to know. And by working with your provider and detailing how the decision affects them, you'll be surprised with how often the health plan will work with you. If the customer service representative still denies the treatment request, the provider or patient can complete and submit a written appeal form to the insurance plan. And you can usually do this by email or through an online form. Although most people don't bother to file an appeal, it's well worth the time and effort, like I said, because the health plans usually do reverse their decision in favor of the patient. So what happens if it's not resolved on the health plan level? It's not the end of the story. You or your provider can still appeal to the state insurance department, and here in Tennessee, that's the Department of Commerce and Insurance. You can also appeal with the federal agency in charge with the particular type of plan. When you look at the toolkit, and again, it was emailed you prior to this webinar, there's a complaints and appeals section on page 11, and it has a chart that shows which government agencies handle appeals for different types of health plans. So, for instance, the U.S. Department of Labor is responsible for self-insured health plans. So those are like the big companies, like FedEx, for instance, that have their own insurance. The Department of Labor would monitor their health plan. And those are the health plans with the employers with 50 or more workers. Then the state health insurance, again, in Tennessee, it's Commerce and Insurance. They handle complaints and appeals about plans purchased by individuals or small groups under 50 people. Whether the plan was sold inside or outside the state health insurance exchange, which we don't have one. We here in Tennessee, people just go to the federal exchange. Okay. And then finally, the health insurance exchange plans, that's the market care, healthcare.gov, the marketplace. The agencies that oversee those plans are the Centers for Medicare and Medicaid Services, or CMS. Now, if you have a patient on TennCare, or if you're on TennCare, the complaint should be filed with TennCare and with the federal CMS, Centers for Medicare and Medicaid Services. So we're going to start with the Tennessee Department of Commerce and Insurance. Even if the complaint needs to go to a federal agency, because states are responsible for monitoring and enforcing parity laws. And like we said earlier, we have state laws that require the department to report to the legislature each year. So this helps them track the number of complaints and appeals from people from each state. Also, the state insurance departments have consumer assistance staff who work with members and make sure the paperwork is completed and filed accurately. And they can also contact the health plan on your behalf and request a change in the decision. So this is an older version of the department's website, but you will still see there circled in blue, there's a section called File a Complaint. So if you have an individual or small group health plan, which is a large amount of people, you would file a complaint with the department. And again, TennCare has its own complaint process for TennCare members. So we're going to look at the Department of Commerce and Insurance complaint process today. And we have an example here. And in this example, we're working with a famous Tennessean named Davy Crockett. So we're going to use his story to walk through what the complaint process is with the department. So this form that you're seeing is on the department's website. So the first section asks for the complainant's contact information. There's space for more than one complainant. So like if there's like 2 or 3 people involved who want to file a complaint, there's multiple places they can file. But only include those names of people who are involved in this particular denial of care. Required fields are marked with an asterisk. So let's look at David Crockett. And in this case, he has been diagnosed with PTSD from his military service. And he needs therapy to proceed with his career goal of serving in the U.S. House of Representatives. His mental health provider recommends individual cognitive behavioral therapy, but the health plan will only approve group therapy. So when you're filling out this form, you're going to scroll down here and complete as much of the insurance information as you can. It is not necessary to fill all the fields before submitting the form, but the more information that you give, the less you'll have to gather after the complaint is filed. Again, somebody from the department can help you with this, or your provider can. So you're going to look at the 2 drop-down boxes and where it says type of insurance. Health insurance is most likely to be related to a group or individual plan. So this is why it's important to know what kind of plan you have. And the most common reason for health insurance complaints are claim delay or claim denial. If you have a complaint about Parity, like maybe the lack of in-network providers or for mental health or substance use disorder, that would go under the other category that's marked here in red. If you believe a Parity violation is involved, you would type Parity in the box marked other. Near the end of the form, you'll see 2 open fields, one to describe the complaint and the other to propose a solution. So it says here, what do you consider to be a fair resolution? So specific information in codes, like the diagnostic codes, will help the department process the complaint successfully. If possible, include the DSM and ICD codes and specific therapeutic modalities. Briefly explain the symptoms, what hasn't worked in the past, and what has worked, and why you believe this treatment would be beneficial for your long-term health and recovery. You might want to point out that this treatment could lead to recovery that saves money for you and the health plan in the long run. So in this example, the therapist proposes 6 sessions of individual therapy before reassessing readiness for group therapy. So there's a compromise, and that kind of solution is likely to be viewed favorably and keep it in your records. Then copy the case number into the field where indicated and click Submit Form. So what happens next? The complainant listed, so that's the person bringing the complaint, in the contact information will be notified promptly, usually by email, that the complaint has been received. If the type of insurance is under the authority of the Department of Commerce and Insurance, they will forward the complaint to the health plan. If not, they will forward it to the appropriate authority and notify you. So if you're on TennCare and you accidentally file this with the department, they're going to forward it to TennCare and then let you know. If the department processes the complaint, here's a breakdown of what will happen. So one of the following will happen. If the complaint has been resolved, the file is closed and you'll get a letter. If an insurance law has been violated, the health plan will be asked to correct the problem. The complaint will be referred to the legal department for further action. If the health plan is not abiding by the policy, the department will bring this to their attention, and if not corrected, the complaint will be referred to the legal department for further action. If the insurer or agent has not responded or has not looked into the complaint in detail, the department will require them to do so. If no violation is found, you'll get a letter explaining this and also offering other options if they are available. The file for the complaint will stay open for 10 days, and that gives you time for a rebuttal if you decide to do that. In all, it takes about 45 days from the time the department receives the complaint to when the problem is resolved, and a complex complaint could take longer. If you feel overwhelmed with how complicated this is, trust me, you're not alone. In response to requests from people across the country, the U.S. Department of Health and Human Services has set up a web-based clearinghouse for parity information and complaints. So by checking a couple boxes and answering a few questions, the website links you to correct governmental agencies responsible for the complaint or the repeal. So we're going to go into some stories here. We'll look at some brief stories that illustrate how common parity violations look from the member viewpoint. So I'm going to give you a chance to read this. So this man has bought a plan from the Federal Health Insurance Exchange. His diabetes medication is on tier 1 with no co-insurance, but the mental health medications are on tier 3, and he can't afford the $240 out of pocket every month. I have to step up by taking less expensive psych meds for 6 weeks. I only get the one I need if the other doesn't work. I changed health plans twice before, had to step up each time. Why can't they look at my record and approve the right drug from the start? So in this case, what should this person do? And this is a group discussion here. So he's got this medication for diabetes on one tier and mental health for a mental health treatment for another on another tier.
Isn't that's a violation, isn't it?
Could be.
Yeah.
It could be. Yeah. So it makes a difference. This is something you have to consider, whether the medications for diabetes and mental health are generic or brand name. Because if it's generic, that's going to be on the lower tier and less money. If it's brand name, it's going to be higher tier. If both are brand name, there may be a parity violation. So if you're charging less money for the diabetes medication, but more for the psychiatric medication, that could be a violation. So here's another example. If the diabetes drug is generic and the mental health drug is brand name, that might not be a parity issue because the health plans have opted to put the more expensive drug on a higher tier. So the moral here is you have to look at whether the plan has what their process for the tiers are. Does that make sense? And if you were this man, what would you do? What would you do in this situation? A question about the inequity and the health and the prescription coverage.
Lisa, I think you'd go talk to your health insurance provider first, the plan customer service folks.
Exactly. Exactly, because they might be able to look into it for you and explain the difference in the tiers. And again, if there is a discrepancy, this might prompt the health plan to look at their internal procedures and their policies. Good job. So we'll look at another one. Okay, so in this case, 38-year-old married woman covered by her husband's small group employer sponsored plan. So in this case, she's saying, my health plan requires prior authorization for mental health, but not for medical care. The doctor prescribed TMS, which is transcranial magnetic stimulation, for my depression, but my health plan denied the service as not medically necessary, despite the fact that I've tried everything. So is this a parity violation? You can also type it in the chat box. Yes or no. Do you think this is a parity violation? The answer is, so Michael wins the prize. Yes. There seems to be a parity problem related to prior authorization because medical care is treated differently. So that's the medical necessity may not be the problem, but so we would also need more information about the criteria used for medical necessity. And again, that's information that you and or your provider can get, and they're required to share that with you. And for this woman, after talking with her provider, who should she talk to next? So Michael had it right last time. The health plan. Health plan. All right, so we'll go to another example. This one will use an example dealing with substance use disorder. This is a 45-year-old man with an individual health plan purchased through the Federal Health Insurance Exchange. Okay, so this is market care or healthcare.gov, the federal marketplace. I'm trying to recover from a heroin habit that started after my dentist prescribed oxycodone for oral surgery. My addiction counselor wants me to take Suboxone, but it's a tier 3 drug in my health plan. I'd have to pay $120 every month. Why am I paying such high premiums if they won't cover the care I need? So is this a parity violation? This one's a trick one, I'm just going to tell you. So in this case, the question is whether Suboxone is comparable to tier 3 drugs for other conditions. Because it's currently a tier 3 drug for most health plans, the likelihood of a parity violation is slim, but it's still worth pursuing. High premiums don't guarantee parity coverage. So when choosing a health plan, this is why it's important to look at what tier your medications are in on the formulary. And then we'll do one more. In this example, it's a 29-year-old married woman covered by her husband's small group employer-sponsored health plan. The health plan refused to pay for my residential treatment for cocaine withdrawal because they said I had exceeded my lifetime limit for residential treatment. I thought lifetime limits weren't allowed anymore. Is this a parity violation? So in this particular case, under the Affordable Care Act, lifetime limits are not allowed in any type of health plan, including grandfather plans. So that's a little bit of a twist here in this example. This is not strictly a parity issue because the rule applies across all types of care, but she should still take action because you can't have lifetime limits. So now we're going to look at some of the resources that are available to you. There are a lot of organizations nationwide and in Tennessee that are paying attention to parity and bringing this to the public awareness. So the website parityregistry.org has excellent information in plain language to help you learn more about parity. And this is sponsored by the Kennedy Foundation, or excuse me, the Kennedy Forum and the Scattergood Foundation. Parity Track is collecting stories of people who have experienced parity violations to help fight for stronger enforcement of state and federal parity laws. So when you submit your story to this website, in addition to filing with the proper agency, you'll help with the overall struggle with parity. And you can give your name or not, it's up to you. You can file anonymously. If you would like more information or assistance, this slide includes some helpful state and national resources. And this is also outlined in your toolkit. Again, we recommend going to the State Department of Commerce Insurance in addition to the other things that you do. That will make sure your parity complaint is registered with the state, which will help strengthen parity laws for everyone. And there are many organizations with an interest in parity. We just mentioned the Kennedy Forum. They actually have monthly meetings for organizations like TATIS, TAMHO, NAMI. And nationally, we all meet once a month to learn about what laws are being discussed in Congress, what bills, and then we get to share what's going on in our states with parity. So it's a really helpful resource. Mental Health America and NAMI and their state and local chapters are involved with parity discussions. The Carter Center in Georgia has started a new focus on behavioral health parity, and they just launched their first national meeting just last week that we were part of. And it was really encouraging to see the number of people from Tennessee on the call. We had a very strong presence. And they're also working to educate the media of the importance of the issue. And also the Wellbeing Trust, they look at a number of healthcare issues and including parity. And then finally, the Tennessee Parity Project. And this is the website for the Parity Project. So NAMI Tennessee and TATIS are among several organizations that launched the Parity Project. And there's a website available which outlines a number of the things that we have talked about today, what a violation might look like, where you can go for resources. The goal is to make sure that plan consumers and providers understand and know their how to exercise their parity rights. So if you would like your organization to have a presentation, or you know people that might want a presentation, or you'd like to learn how to give this presentation, you can contact me and my information is there.